I'm Dr. Greg Nigh. It's great to talk to you again today. Today I'm going to be talking about it's something that seems a little maybe tangential to directly to health, but it's not. And I hope I can explain why that is. The topic is this obscure lab technique that has now become center stage, something called polymerase chain reaction, PCR. So, if you'll recall, during the insanity of COVID, PCR was a test that was used to determine if somebody was infected with COVID. Did they have the infection with the virus? So, first of all, let's just make sure this is on the table. The entire COVID thing that happened, that was planned and developed by the Department of Defense, and it was implemented by Health and Human Services, mostly by the CDC in coordination with the NIH. But that was a Defense Department program that was simply implemented as a public health program. Yes, there are lots of resources where you can find all the details about that. I'm not going into it, but I'm just laying that background because the use of PCR as a diagnostic tool, first time ever that PCR got used diagnostically, that was announced it was around, I think, February or March of 2020. Now, I happen to know a bit about how PCR works because when I was working back in the 90s I did a lot of research on HIV and AIDS, and PCR, a relatively new technique at that point. Kerry Mullis developed that in the late 80s, was given the Nobel Prize for it in the early 90s. That technique was what got used to determine what was called the viral load. As people might recall, related to HIV, everybody was checking their viral load. And that was something that PCR was used for. PCR was never used to diagnose an HIV infection. That was very explicit. That was a different kind of a test. PCR was used to just determine the viral load for people already infected. And given the nature of PCR, you cannot possibly determine a viral infection with that technique because PCR is looking at very small snippets of DNA or RNA, depending. There are different ways of doing the test. You're not looking, you got this whole stressed out virus that's 30,000 bases long, referring specifically to SARS-CoV-2. Again, there's more to say about that, but let's just say the standard line, that's 30,000 bases. PCR done to detect an infection with that 30,000 base virus, beads on that string, PCR is looking at around, I actually ran the numbers on this. It's about 0.7% of the entire length of this thing. Maybe I got a decimal place wrong and it's 7%, but I don't think so. Either way, the point is we're not looking at this whole thing. We're looking at a very small snippet of it. So you run a test, you stick that thing in somebody's nose, and you look for the virus. That's what we understand is happening. They're looking for the presence of the virus to say, yes, you have COVID. They're not looking for the virus. The virus is this long. They're looking for this little snippet of the virus. If they find this little snippet of the virus, they are assuming, they are leading you, all of us, the public, the world, to believe that they found the whole virus. I knew the moment I heard that they were using PCR to diagnose cases of COVID, I knew this was a psychological operation. The only reason for PCR to be used as a diagnostic tool is to inflate the numbers. There's no other reason. No other rational reason. It completely goes against what the public health departments should be doing in terms of trying to track how prevalent this disease actually is. Okay, so PCR gets implemented as a diagnostic tool. Clearly, so let's just say, I get exposed to the virus, and my immune system being adequate, my immune cells attack the virus, do what it does, spit out some hydrogen peroxide on it, and dissolve it into little bits. I am completely not symptomatic in any way because my immune system responded in a normal way. I get tested. Now, you might wonder, actually, why did they need to go all the way to the back of people's sinus cavity to get a sample of this virus when supposedly we're like passing it all the time just by coughing and talking, and we had to wear the mask so that we don't put little spit particles out. Why are they going to all the way back here to find that virus if we're supposedly it's right on the tip of our tongue all the time? Okay, that's a different question. So I have been exposed to the virus. My immune system is adequate, chops it up into little bits. PCR, they do the test. Oh, that little fragment is one of the bits that they find on that swab. PCR comes back positive. I have just become a case of COVID. I am reported as a case of COVID to the public health agencies, when in fact, I completely successfully chopped that virus up and it didn't cause me a single problem. We have no idea how many people that scenario played out for. We can't possibly know. What we can know is that there were thousands and thousands of people in hospitals who were diagnosed, who were there not because of COVID. They were there because they tested positive on a PCR test and so became a COVID case in the hospital. Again, inflating of uh, the numbers of people put in a hospital due to COVID. There were thousands of people simply in a hospital for other reasons who tested positive and then became, in the news, they became, oh, another case of COVID in the hospital. The reason I'm bringing this up now, I mean, hopefully this is somewhat common knowledge with relation to what happened in the past with COVID. But more importantly, this is going to happen again. Now that they have opened the door to using PCR diagnostically, I guarantee they're going to be doing that again. That is going to be how the next attempt at generating fear around a pandemic is. That's one of the ways that they will do that, because you can easily inflate the numbers of people being diagnosed with whatever you're talking about if you use PCR diagnostically. It should never, ever be used that way. Terry Mullis, the guy who invented PCR, was adamant that PCR absolutely is not a diagnostic tool. So consider this a public service announcement so that in any future event where they're saying, oh, the numbers of cases of this infectious thing are growing and we're all to be on alert because it's coming moving our direction or whatever, look into the details of how they're diagnosing those cases. Because if they're doing it with PCR, they're doing it to scare you. They're doing it to make you afraid for your safety. Because once they do that, they can manipulate people. They can coerce people into engaging in behaviors that they want people engaging in. So I'm going to leave it at that because, of course, I can go on and on. But I encourage you to subscribe and like and all that to this podcast. And I will be talking about some related issues around this in the future. But for now, hopefully, you got some at least a better understanding of how the numbers of cases around COVID got inflated and how that could be used against us in the future. All right. I hope to see you back here before long.